Welcome everybody. I'm just making sure we are all set and ready to go. Welcome to Back Talks with Dr. Sean McWilliams, and happy Wednesday to you. Just making sure that our Facebook and YouTube are all live. So if you got questions, hey, there we go. Now we're in business. All right. And just make sure YouTube is all up, and you know it's not always perfect. I'm sorry, I'm a one-man show, so I don't have my back office person. All right, we're live now on both. That way I can see your comments. If you got comments, I want you to say hello. Hey, what are we talking about today? I want to talk to you about if you're dealing with back pain or neck pain, especially if they're chronic. They could be due to facet pain or bulging discs or herniated discs. And if you're dealing with that or spinal stenosis, and your doctor is saying this to you, no way are you doing spinal decompression. That's what we're going to be talking about today. And because there's a reason that a lot of you orthopedic surgeons are going to say no way to that. One of them is financial for them, and the other one is they just never learned about it. No one's ever taken the time to go meet with them and explain spinal decompression and show the science behind it. So that's what we want to do today for a minute, and just show you a couple things that you should ask your doctor if your doctor is telling you that no way to spinal decompression. So let's get on with it, and let's talk about this. So, and the reason I want you to be armed with this is because I don't want you winding up like this. You know, I showed my girlfriend Marisa the other day a horrible picture of this young lady, probably in her 30s, with, you know, she looked like Frankenstein. She had staples going all the way down the back of her neck. There must have been 35 of them. Rods, every single level of her spine fused, and I saw no fractures in there whatsoever. Probably, again, herniated discs with radiation going down her arms, hands, and fingers, things that can usually be managed with spinal decompression extremely well. And this is what this lady looks like. This isn't her, but this is what happens. And when that happens to you and you make that choice, you know, and a year later, she still said that she could barely feel her arms and her legs. And no one's going to go in and take that hardware out for her. Nobody wants that liability as a surgeon. You got to understand that. So you're screwed basically. And that's a horrible place to be. I don't want you in a position where you're not empowered. And so that's why we do this stuff, okay? Because I don't want hardware like that inside. And believe it or not, that hardware breaks a lot. Those rods break a lot in people. And that means now you got to go back in and have a whole resurgery again. And that's not good. At all. So let's show you some stuff to prevent that. So is spinal decompression, you know, should your arms be crossed about that? Well, I don't think so. I've been doing it for almost 2 decades, and you know, let's show you a couple things that we do to make sure that we feel that you're a good candidate. Well, one of the things that we're going to do is we're going to do x-rays like this, where we have you bend forward and we have you bend backward a lot of times. And these are called flexion extension stress views. So if you go to somebody in your community, this is something they should be doing. They should be taking specific x-rays. And obviously we're talking about the low back right here. And what we're looking for is what you can see on this red line is at the back of the bones. And when I say back of the bones, I'm talking about this kind of thin white line right here that you can hopefully see, that those all line up with each other. And then again, when you go and do a back bend, again, that the back parts of the bones line up with each other. If we were to draw a line down, just like you're seeing right here. That's what we want. What's that mean? That means that there's usually good integrity, good strength, no damage to the ligaments, the structures that hold our bones together, and it's usually very safe to do spinal decompression on those people. So let me show you what we're talking about. So as this person bends forward to touch their toes, and then they do a back bend like this. What we don't want to see is we don't want to see shifting like this or like that. And so you can tell on those x-rays because you would see this movement on those x-rays. So that's one of the things that you'd want to make sure that you get done is a flexion extension x-ray to see for stability. What else do you want to get done? Well, you want to get MRI done. And so any good spinal decompression facility is going to do MRIs on you. If your facility is doing decompression on you and they have no MRI, you need to run. All right. I've worked in a lot of clinics. I do a lot of coaching. That's the number one thing that I have to get most of my doctors to start to do is to start to do MRIs. And there's a reason they don't order MRIs is because they don't feel that they have enough intelligence, and not that they're not smart people, but they don't have enough background to feel confident to read the MRIs and know what to do with them. And as a result, they don't order them. So do not go to a clinic that will not take flexion extension x-rays on you and do a pre-MRI and a post-MRI. So we did pre and post MRIs on every patient that came in to see us. So and here's a perfect example. So you can see this big black bulge that's happening right inside there. That's this gentleman's herniation. You can see it actually indenting into a spinal cord. You can see this big massive blob right there. That's his herniation. So when this gentleman came to see me, he had already gone through a treatment program of spinal decompression in another clinic and got 0 results. So he came to me after hearing about our reputation, and he had severe low back pain, sciatic pain, that's pain that goes down the buttocks and legs, had muscle weakness in his legs, was constipated, could not travel or be an active dad. So we did the MRIs, we did the x-rays, we did a very thorough neurological examination on him, which we do with every single patient. We thought he was a good candidate for it. I proposed a program, we did it, and this was him 12 weeks later. No herniation in his low back. And remember, the herniation doesn't even have to withdraw this much. So a lot of people think, oh, it's got to withdraw all the way back in for it to work. No, we just got to get pressure off the nerve. Now, we'd like for it to draw back in as far as we can get in because it gives you much less chance that it's going to hit a nerve, and we want it to heal properly. But, you know, sometimes a small amount of that disc getting off that nerve can really create miracles for you. They really can. I see it all the time. So I want you to make sure that your doctor, or wherever you go, is going to do pre and post MRIs on you. What else should you be looking for? Well, you should see if your doctor has been awarded a top doctor in the United States for doing spinal decompression. In 2019, 20, and 21, I was voted one of the top spinal decompression doctors in the United States. I only tell you that because I hope that it's a sign that we are really serious about doing spinal decompression. We do all the right stuff, and we have great successes for our patients. You know, in my clinic, we had a 93% success rate for our patients. 93%. That's really high. The average is probably 88. Sometimes, you know, maybe a little bit lower depending on the table they're using, the equipment they have. So you want to ask, hey, is your doctor, does he want any awards? I think that's important. So what are some of the benefits of doing spinal decompression? Well, some of the is that intermittent spinal decompression therapy has a positive effect on disc nutrition. What's that mean? Well, if you go get a microdiscectomy or you go get a fusion, you're cutting out bad stuff that's pushing on the nerves, and with the hope that it relieves your pain. The problem is that you haven't done anything, and nor will you be doing anything to get your disc to be healthy. And what happens then? Well, what happens is then you still have diseased disc tissue inside your body and nerves, and they will continue to degenerate and get worse with you over time. And typically, most people that get a back surgery are going to need it another 1 in 3 to 5 years. That is the statistics when you look at it. So we want to make sure that we're getting proper nutrition in the disc because that's what the disc needs to heal. As you alternate distraction followed by relaxation, the discs get more blood supply into them, and they bring more nutrients in for healing. In addition, they push out their waste products. So spinal decompression therapy can be used as a prophylactic to help reduce the impact of disc aging as well. So if you're just getting older and you know that there's a family history of degenerative disc disease or bad back issues in your family, start doing spinal decompression as a preventive issue. It's kind of like spinal hygiene, you know, you brush and floss your teeth. You want to do the same thing with your back, okay? So that you're not dealing with this one and waiting for them to get damaged. You're actually keeping them healthy and hydrated. So one of the things I want to show you is that you also want to look at research. And this is a pretty cool study. You know, this is from Dennis McClure, which I'm going to show you here in a second. And Dennis McClure was a neurosurgeon. And Dennis McClure did a lot of surgery for decades. He was very well known and also did a lot of research. And as he progressed through practice. You know, he went from what they taught him in school, and as he learned more and more and saw the success slash not success rate, he looked for ways to help his patients better. And he came across spinal decompression. And he started doing spinal decompression on the majority of his patients that were surgical candidates that he normally would have done surgery on. And this is what he found out. And I think it's a great study. This is 1,200 patients. And after doing spinal decompression, and these were all pre-surgical candidates, I want you to know that as well, 86% of these 1,200 patients had an 86% improvement in their mobility, their actual ability to walk and move and bend. They had 86% reduction of their pain. They had an 86% improvement of their ability to be active, to go for a walk, walk your dog, go for a walk with your significant other, go for a hike, go to the grocery store, go take a shower by yourselves and feel confident, go pick up your grandchildren, play with them, things like that line. And then what's really amazing is that 76% had improvement of pain remission. They were 76% pain-free at the end of a year for doing spinal decompression, and all these people would have had spinal surgery. You know, you guys, you gotta know, this is all I do. I'm constantly looking at Facebook pages. I'm constantly studying research to bring it to you. This is my life. This is what I love to do. You know, I got a guy that's in the islands of people around the world, you know, that have done the program that we've created because they don't have anybody in their communities that does spinal decompression. So 2 years ago, I created a program that comes to you instead of you having to go to a doctor's office 3 times a week to fix these issues. So it's called Disc University. We're super proud of it. It's about 27 video modules. We tell you what piece of equipment you need. We show you exactly how to use it. And we take you through basically the same exact program I would take you through if you came to my office. But you don't have to come to my office. You can just do it from the comfort of your home. So it's really amazing. This guy that I'm working with right now, he couldn't even walk for 1.5 to 3 minutes. He'd have to sit down. He's been with us for over a month now. And his daughter even told me, she goes, my dad just walked an hour. He didn't want to travel anymore. Now he wants to travel. And that's what this is all about. That's why I do this, and we love it. You know, if you're suffering with neck pain or back pain, if you know perhaps you have a bulging disc or herniated disc, and you're not sure what, you know, what to do about it, and you're looking for a non-surgical approach to it, I invite you to come and get on my schedule. And so I just want to make sure I'm not missing anybody's messages if they're saying hello to us. So how do you get on my calendar? Well, you go to this right here, booking.drshawnmcwilliams.com, and you can just fill out a small little form. You can let me know what you've been suffering with and what you've tried so far, perhaps maybe what has worked for you or what hasn't worked for you. Do you have images of your back? And if you do, we want you to send those to us so we can take a look at them and we can have a real conversation together. So I hope you'll take advantage of that. You know, normally I charge $197 for that in my office. Right now, while we're trying to build our community and get this message out to people, I'm doing it complimentary. So you get me for free for 15 to 20 minutes to go over this with you. If I think you need surgery, I'll let you know. If I don't think that you do, and I think perhaps you could actually get healthy and feel better from the comfort of your home, I'd love to share with you our program, Disc University, and see if it can change your life like it's changed hundreds of people's lives around the world right now, and we're growing every day. So I hope that you will take advantage of that. It's easy to do, costs you nothing except a little bit of time. And if your spouse, if you have a significant other with you, I would like for them to be part of that call as well so we can have a great conversation and I can help guide you and lead you in the right direction. If my course is it, awesome. And if it's not, and if it's something else that I think would benefit you better, I want to do that for you too, okay? So I hope that this has brought some value to your life. If it has, I hope that you'll subscribe to our YouTube channel and our Facebook page. Leave me a comment, please, on what you thought about this today. And if you have any questions, leave me a comment as well. And of course, if you'd like to talk with me live, on a Zoom call, go to booking.drshawnmcwilliams.com and get that set up. And let's chat and let's bring some hope back into your life. So I want to make sure I didn't miss anybody's messages. If anybody said hello that I didn't get to chat to, and if I didn't, I hope that you'll share this. I'm one person. I'm not going to be here forever, but my mission is to help millions live again without surgery and without drugs and living on drugs, narcotic drugs, and having rods and bolts and screws in their spine and being in pain for the rest of their life, and giving up on a lot of their dreams. And if you got a person that's getting close to that, I hope you'll share this. Make sure they set an appointment up with me, please, and let's see if we can help them non-surgically, like we have thousands of other people, and just like we're doing right now around the world. That's my mission, is to bring this technology around the world so that we have less surgeries and people enjoy their lives more and get back to doing the things that you love to do, being the mom or dad that you want to be, being the worker that you want to, the spouse. If you love to dance, you love to go for a walk, play with your dogs, go for hikes, camping, cruise, vacations, whatever it might be. I want to help you get back to the things that you love to do, because that's what God made you, is so that you can go and do that and share this message and tell others. You know, the body's a self-healing organism, and it can do a very miraculous job of doing that if, with just a little bit of help sometimes, in the right way. And I'll tell you what, I've seen unbelievable miracles happen for people with spinal decompression. I really have. And I want you to be next. So let's see if you're a good candidate for it. So make sure you get on my calendar, okay? All right, guys. I appreciate y'all so much. Thanks for being here, and I will see you next week.